I'm a bit worried about having like the virus, because I went up to the hospital last month because of what I had, like the headache and that, and I weren't too sure whether I had the virus or not, and they didn't do a swab.
Yes, that's a really good question. And the trouble is, in the past, it was very difficult to get a test. You can get them now, but really it should be if you have symptoms, then go and have the test. So if you've got a new cough or a fever, or you suddenly lose your sense of smell, then it's worth booking a test. Now, the test now can be done at home. You can ask for one to be sent for you, or you can go to one of the testing centres. But to be honest, the test is not perfect. So sometimes the best thing is to either go on the website, if someone can do that for you, to check if your symptoms are like that, or ring your doctor and have a conversation, and he can advise you whether it's likely you need a test or not. Because sometimes the test, it was about if 10 people had the test and they had the illness, 7 of them, it said they had the illness, and 3, it got it wrong. It said they didn't have the illness. So it's better to actually, if you ring up and you had cough, loss of sense, smell, and a fever, we'd say, well, it's likely you have COVID. Look after yourself. If this is happening, this is what we need to do. It's a bit like when we have flu. You don't always need to be tested if you have influenza. It's normally on the symptoms. So you don't need to worry that you haven't had a test if you didn't have the right symptoms. Doesn't sound like you had COVID. Headache is normally one of the symptoms.
I had it, like the headache, my face was like really hot and feeling sick, and my eyes were like really tired.
So that sounds more like a sinus problem. I would have thought that's what they thought it was, and the swab wouldn't have helped them.
Right.
If it was that, then you got better, and most people with COVID will get better. But we see a lot of people that haven't got better, and I know that worries a lot of people. But most of you are quite young, so actually you probably would be okay. But don't take that risk. Wash your hands, keep your distance. And that's the best thing. And also don't forget that if you are feeling unwell, ask for help. Ring the surgery or go on the 111 if the surgery is closed.